Hey guys, how's it going? This is FixerMed. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. This will be part 7 of my multi-part video series providing a broad overview of anatomy for these exams. So without further ado, let's go ahead and get started on today's content. Today I'd like to build off the last points I made in part 6 and expand upon the cutaneous innervation of the hand. Cutaneous innervation of the hand is predominantly mediated by the median, ulnar, and radial nerves. The median nerve supplies the lateral 3.5 digits in the adjacent palm. The ulnar nerve innervates the medial 1.5 digits in corresponding palm, while the radial nerve supply primarily provides sensation to the dorsal aspect of the hand and lateral 2.5 digits. The illustration to the right should show the location of each nerve on each area of the hand that it innervates. So this will be a good tool for your notes. Moving on. Avascular necrosis of the femoral head. Avascular necrosis of the femoral head is often seen in elderly women with osteoporosis, commonly resulting from a fracture of the femoral neck. When a transcervical fracture occurs, it can interrupt the blood supply to the femoral head through the retinacular arteries derived from the medial circumflex femoral artery. Inadequate blood flow through the ligament to the head can lead to avascular necrosis, a serious complication of this injury. And as you can see to the right, I have a picture of the healthy hip joint and avascular necrosis, which shows the femoral head collapsing, which eventually leads to avascular necrosis. So, moving on. Knee joint injury, unhappy triad. Knee joint injuries often involve the so-called unhappy triad, which is frequently seen in athletes, especially in situations where the lateral side of the knee is impacted, such as during a football tackle. This triad consists of 3 commonly affected structures: the tibial collateral ligament, the medial meniscus, and the anterior cruciate ligament. Among these, the tibial collateral ligament is particularly susceptible to tearing due to its frequent exposure to trauma on the lateral side of the knee. And as you can see on the picture to the right, I illustrate where these injuries often occur. And as you can see, unhappy triad, tibial collateral ligament, medial meniscus, and ACL, primary areas. All right. Now I'm going to be moving on to some questions. Which nerve primarily innervates the medial 1.5 digits and the corresponding palm in the hand? Pretty first order question, but nice review. All right, I think I gave you guys enough time here. Gonna move on and see what the correct answer is. The ulnar nerve primarily innervates the medial 1.5 digits and the corresponding palm in the hand. This nerve runs along the ulnar side of the forearm and enters the hand through Guyon's canal, providing sensory innervation to the ulnar half of the palm, the ulnar side of the back of the hand, and the medial 1.5 digits. Therefore, the correct answer is ulnar nerve. Nice one-liner question. Let's see why the other answer choices are incorrect. Median nerve primarily innervates lateral 3.5 digits in adjacent palm, not medial 1.5 digits. Radial nerve primarily provides sensation to the dorsal aspect of the hand and lateral 2.5 digits, excluding the nail beds. Musculocutaneous nerve primarily innervates the muscles in the anterior compartment of the arm and does not provide sensory innervation to the hand. Axillary nerve primarily innervates the deltoid and teres minor muscles, and it does not provide sensory innervation to the hand. Moving on to the next question. Which artery supplies blood to the head of the femur, contributing to avascular necrosis in cases of transcervical fracture? All right, let's go ahead and move on. If you need more time, please pause the video. In cases of transcervical fracture of the femoral neck, disruption of blood supply to the femoral head occurs, often leading to avascular necrosis. The blood supply to the femoral head is mainly provided by the medial circumflex femoral artery, and injury to this vessel can compromise blood flow to the femoral head, resulting in avascular necrosis. Therefore, the correct answer is B, medial circumflex femoral artery. Let's go ahead and see why the other answer choices are incorrect. Popliteal artery. Popliteal artery primarily supplies blood to the lower leg and is not directly involved in providing blood supply to the femoral head. Deep femoral artery. While the deep femoral artery contributes to the blood supply of the thigh, it does not directly supply blood to the femoral head. Inferior gluteal artery. Inferior gluteal artery supplies blood to the gluteal region and the posterior thigh, but does not contribute significantly to the blood supply of the femoral head. Superficial femoral artery. The superficial femoral artery primarily supplies blood to the muscles of the thigh and does not directly contribute to the blood supply of the femoral head. Moving on to the next question. Which structures are commonly involved in the unhappy triad of knee injuries? All right, think I gave you guys enough time here. Moving on, if you need more time, please feel free to pause the video. Moving on now. The unhappy triad of knee injuries typically involves the tibial collateral ligament, medial meniscus, and anterior cruciate ligament. This combination of injuries is commonly seen in sports-related trauma, particularly in scenarios where the lateral side of the knee is struck, such as in football tackles. Therefore, the correct answer is C, tibial collateral ligament, medial meniscus, and anterior cruciate ligament. Let's go ahead and see why the other answer choices are incorrect. Tibial collateral ligament, patellar tendon, lateral meniscus. This combination of structures does not represent the classic unhappy triad. Anterior ACL, medial meniscus, fibular collateral ligament. The fibular collateral ligament is not typically involved in the unhappy triad of knee injuries. Posterior cruciate ligament, lateral collateral ligament, medial meniscus. The structures mentioned in this choice do not correspond to the classic unhappy triad pattern of knee injuries. Patellar ligament, anterior cruciate ligament, medial collateral ligament. While some of the structures mentioned may be involved in knee injuries, they do not constitute the typical unhappy triad combination. And that will do it all for this video, guys. If you have any questions, comments, or concerns, please feel free to leave them in the comment section below. Pretty superficial stuff today, so I expect most people to pick it up. First order concepts for the most part. If you need a deeper review, MSK series should hopefully be coming out soon. Still working on a lot of reviews right now, mainly trying to cover the general disciplines. So yeah, just want to give you guys an update on that. But if not, be sure to leave a like and subscribe on this video. It really helps the channel out. And that's all I have. This is FixerMed signing off. Good luck studying, everyone, and goodbye.